Okay, I think we'll go ahead and get started at least with some introductions, and hopefully we'll have some other folks join us along the way. Thank you all for being here. I really am looking forward to this conversation, and what a great plenary session we had coming into this, and it really shows how important research is in both figuring out whether policy has been effective and also looking at what some of the policy research gaps might be. And that's part of the subject that we want to talk about today. So my name is Nancy Buermeyer. I am the Director of Program and Policy for Breast Cancer Prevention Partners. We're a national organization located here in California, and we work to prevent breast cancer by reducing toxic chemical and other environmental exposures that have been linked to the disease. We are a science-based organization. Everything we do is based on a foundation of the peer-reviewed science. And we do our work in a number of different ways. We do policy outreach, we do public education. We work in markets to try to convince companies to voluntarily make safer products using consumer demand. And then we also do policy advocacy, and we do that at the state and federal level. We've done a lot in California because we're located here, but we also work in Congress to try to get chemicals better regulated and reduce exposures. Many of the exposures that you heard about in the previous session. So I come at this conversation as an advocate. I've spent 35 years working on a variety of different issues, from toxic exposures to civil rights issues, both in DC and here in California. And I know firsthand how important it is to have solid research information available to help policymakers make better decisions as they consider laws and regulations and other policies before them. As a breast cancer organization, we also have a very long relationship with CBCRP. We have been closely connected to this amazing organization for a really long time, and I'm super grateful for the work that they do, particularly in the area of primary prevention and reducing disparities, and also in the policy realm. And I have the honor of chairing the Policy Research Advisory Group, which guides the policy initiative that CBCRP funds. And it's a very unique program that provides short-term, relatively small grants, specifically looking at policy research gaps and trying to fill those gaps to provide information that can be relevant directly to legislation at the state level, as well as other types of policy. So I'm super excited to be a part of that. Garen, who you'll hear from in a minute, she served on the PRAG with me for many years, and AJ has been the recipient of a few of those grants. So with that, what I want to do is introduce AJ and Garen and have them make some introductory comments. And then we want to make this as interactive as possible. So I will ask some questions, but mostly I want you all to weigh in if you have questions or thoughts or experiences that you want to share. It's going to be an informal conversation, and one that I hope that everybody will participate in. And since I know a lot of you, I'm going to actually call you out, so be prepared. So we'll start with AJ. AJ Scheitler is the Director of Development, Engagement, and Strategic Planning at the UCLA Center for Health Policy Research. She also manages several large programs at the center, including the Data Equity Center and the National Network of Health Surveys. And she has conducted a number of research projects to provide evidence for policymaking in areas of patient experience and the intersections of health and education. AJ holds a doctorate of higher education administration from Northeastern University, a master's in adult education and training from Colorado State University, and a bachelor's degree in communications from the University of Central Florida. And of our panel, AJ is sort of the most pure researcher. So I'm going to have her start us off with a discussion about some of the things that she's worked on and things that she's interested in. So AJ, take it away.
All right, good afternoon, and thanks so much for the introduction. And good job on the last name. I know it's not always easy. But yes, I am AJ Scheitler, and I am with the Center for Health Policy Research at UCLA. I've been there for 16 years. Our center is about to turn 30 years old, and we've been doing fantastic work that I'm so proud to be a part of. If you are not familiar with our center, I invite you to check out our newly relaunched website, because we have a lot of really exciting programs going on there. The one that many people may be the most familiar with is the California Health Interview Survey, which we run out of our shop. It is the largest state-based population health survey in the country, and we have all of our data available online. And so if you are a data nerd, please check it out. But we also do a lot of research both on that data and both in many other areas of interest, all of which lead back to policy in one way or another. It's either evaluations of policies and or state and local programs that we have, or as in the case that for the work that we've done in the past for CBCRP, trying to identify opportunities for policy that should be considered within the state of California. I have just completed our third project that we have done for CBCRP. The first one was barriers to breast cancer care. And then we built on that and looked at barriers to breast cancer care for women whose cancer had metastasized. They are two slightly distinct populations, and they face some overlapping but some very unique barriers across the state. We interviewed women who were themselves patients, but also their providers and community health educators, community health advocates, and different women who work in support services for those with breast cancer. We talked to them about their experiences, and I think that the way that we designed our study was particularly important, because something that we have found across all of the studies that we've done is that sometimes there are laws on the books that aren't being implemented the way that was intended. The legislature, when they do things and they really have good ideas and they have good intentions for what they do, it's important that policy gets implemented in a way that is going to have the results of what the policymakers were intending. And so the conversations that we had and the interviews that we conducted with these women and their support services and providers really painted an important picture of what's happening on the ground for women every day, sometimes despite what's in law on the books. And so when we got done with our study and we collected these stories and we looked at the major themes, the major common barriers that women were experiencing, we went to Sacramento and we sat down with legislators and we said, this is what's happening. And in one meeting with CDPH, they brought one of the books and they said, we looked at one of the barriers. You said, no, here's the law right here that we can point to that shouldn't be happening. And I said, well, that's great. However, I'm telling you that women are still experiencing this. And so we need to look outside of the box, outside of the written policy, to see what other things we might be able to do in order to make sure that policy is actually being carried out. The most recent study that we did was on barriers to breastfeeding in California, because there is a link between breastfeeding and the risk that women face for cancer. CBCRP is very interested in trying to support this activity, and many of you who yourselves might be mothers or may have friends and family members who are mothers may be very well aware of the challenges that women face when they want to breastfeed to either the American Pediatric recommended standard of a year or the WHO standard of 2 years. That unfortunately is not as easy as one might think it is, just knowing how all the health benefits to both the mother and the child. It's not as easy as it sounds, but it was, again, very important for us to collect these stories, to hear what's happening to women in their own voices. And it gave us the opportunity to give some very powerful messaging to the legislators in Sacramento to get their attention on this issue and hopefully get them to consider some policy levers that we identified that would help overcome the barriers that we discovered that women are facing. I look forward to sharing more about these studies, and I look forward to answering any questions you may have. But I believe in having these conversations with lawmakers, that the way that we've conducted ourselves, it resonates with them. It hits home when we can share the not just quantitative data, but also qualitative data and the experiences of women. It delivers the messaging in a very powerful way, and I hope it gets action where it needs to be.
Excellent. Well, thank you very much. And as a member of the PRAG, oh, you had a presentation, Garen. Who knew?
It magically
threw me for a loop here. I look
it-
forward. I just want to say thank you to AJ for all the work that she has done. And we've really enjoyed seeing the reports that have come out of your shop and looking at how those have been presented in Sacramento, and look forward to seeing more change come about. So I'm going to introduce Garen Corbett. Garen is the director of the California Health Benefits Review Program, which is a mouthful, and I don't even know how you say your acronym, but you can tell us that in a second. In his role, he leads an interdisciplinary team that provides evidence-based analysis of pending California health legislation to the California legislature. So he is the net between the research that's out there and the policymakers that are trying to make decisions about what to do with it. He holds a master's degree in public administration from the University of Massachusetts, Boston, and a bachelor's degree in sociology with honors from Brandeis University. And Garen's work has contributed valuable insights to improving health policy and the policymaking process. So, Garen, take it away.
Thanks, everyone. And thank you for sticking with us on a Friday afternoon. I know that's not easy, so I thought at the very least I could provide pictures of flowers so that you can imagine, if you were doing something else, that you'd be out in beautiful fields of flowers once the rains perhaps stop. It's a pleasure to be with you here this afternoon. It's a pleasure to be with Nancy and AJ, who I've had the good fortune of working with in various ways for a number of years. So what we do, and the acronym is CHBRP. Along with the field of flowers, I can provide birds. But what we provide is, as Nancy said, directly serving the legislature. We're set up to directly bring independent and objective analysis on introduced legislation, which I'll get into in a second. I'm going to try to stick to about 3 minutes here, so I'm just briefly going to talk about the role that we serve in providing this sort of net or bridge to the California legislature, how we support and enhance policy discussions, and a quick overview of some of the reports that we have produced on breast cancer related legislation. So first, what is CHBRP? And it's awfully close to the acronym of the California Breast Cancer Research Program. We were housed at the University of California Office of the President for about 14 years. So we had lots of C acronyms all running around. It was actually there, but our program, CHBRP, is based out of the University of California, but we work with faculty and researchers from across the system. We're now based over at the UC Berkeley campus. We came over to Berkeley about 6 years ago from the Office of the President. But what we do, besides a core team of analysts that are sort of the full-time folks that try to keep this ship afloat, is we work with about 40 faculty and researchers and analysts from across the University of California system, even a faculty member from CSU as well. And those folks, we engage percentages of their time, particularly when we are working on the legislative reports, which I'll get to in a moment. But when I say rapid, and you compare in typical academia, a report takes a long time. I'm working on a report with some of AJ's colleagues at UCLA for the California Department of Public Health. It's a 2-year process. Our original report was done in 60 days. So we have to have systems and apparatus to do that. And the reason why we do this in 60 days, and I get the gray hair as a result, is because it's really for the legislature at their request, meeting their timeline. So there's about a 60-day gap between the bill introduction deadline in the California legislature and the deadline for those bills to be heard in the first house in what's called the policy committee. So that's really, it was designed to really serve the legislature. Other states have programs like ours, but they don't serve the legislature directly. And they typically work on bills over 6 to 12 months. I want to sort of reinforce the idea that neutral analysis is key. We're not making recommendations. So the topics are is health policy broadly, but really focused around health insurance. And that can lead to a lot of different things, a lot of different types of topics. The core bread and butter of the work that we do are on things called health insurance benefit mandates. And generally, there are things that are proposing coverage or terms of conditions in health insurance that's regulated by the state. When I say health insurance regulated by the state, that's things like Medi-Cal, HMOs that employers offer that aren't self-insured, and of course, people going into the market and purchasing their own health insurance, for example, through Covered California. And the mandates can affect things like screenings or particular treatments for various diseases and conditions. For example, we've looked at bills over the years requiring certain kinds of screenings or treatments for breast cancer. We look at things that affect cost sharing or prior authorization or things that require processes within the healthcare system. And those are sort of terms and conditions. And then we also look at bills that might affect what's called the scope of practice. For example, requiring health insurance to reimburse the services that an acupuncturist provides or a pharmacist in terms of medication management, all kinds of topics. And one of the exciting things is that we generally don't know what the topics are until they show up in their inbox. And in typical years, we do 15 to 20 of these all in the same 3 to 4 month period. Here are some bills over the years. Many of the bills sort of across the country relating to breast cancer were passed in the 90s and the early 2000s, but there continues to be bills that we see even up comparatively recently. Just a sneak thing that I want to tie in. We work with faculty. When you think about reports generated by faculty, my favorite people in the whole world, brevity isn't always the thing that one sees out of that process, particularly multidisciplinary teams of people committed to providing the best review of the evidence, the most accurate cost projections, and the most rigorous of public health impacts. Those are the things that we provide in our reports. But we're also committed to meeting people where they're at. 44% in a Google poll of 18 to 24-year-olds, many of whom are our primary audience as legislative aides in the legislature, don't even search Google for information. They go directly to TikTok. So the world is changing. So yeah, for better, for worse. And the world is changing. So here's an example of we turn our 50-page reports into one-page infographics that we have been doing with each of our reports. And so that's just a little teaser about how do we, in our role, filter this incredibly broad world of information. We just did a report on telehealth. There were 1,400 new articles in a 2-year period. How do you take that world of information and synthesize it so it's actionable for policymakers? So I look forward to the rest of our conversation. And I just do a teaser is any of the work that we have done over the last 22 years is available up on our website, available to anyone at any time. Looking forward to the conversation. Stop sharing my screen.
Thank you, Garen. That was awesome. I think we have a little bit of a poll to have folks to people take a look at. Is that what you just put in the chat, Sharima?
Yes, it is. The last chat I just put up is the link to the poll.
So we
No.
just wanted to get a sense of what people were interested in learning about. So if you want to click on that poll and let us know sort of what aspect of this overall subject matter you're interested in, we can try to tailor the conversation that we have to that interest. And then, as I said before, we're going to want folks to engage as much as possible because we really want this to be a conversation, not us talking at you. So I'm going to give folks just a minute to go to the poll, and I'm going to go there myself and see if I can see what's going on.
What if we're interested in all of them?
Then ask a lot of questions.
Yeah, I'm debating between two of them at least.
I think it's set up you can only choose one. I'm not sure.
It is.
That is how I set it up. I'm sorry.
So
Yeah, I want to select them all too. I haven't figured out what I'm going to do when I grow up.
okay, I'm gonna pick one just so I can sort of see what the results are. Okay.
Oh, I can, oh. No.
Developing. All right. So developing research to inform. So like, how do we decide what the research should look like? I suppose if you wanted to engage community in research, you'd be in a different breakout session. So that makes sense. Cool. All right. I have to say, in the world of translating research language to language understood by policymakers, the notion that those staff are going to TikTok is a little bit terrifying to me, as somebody who has never logged into TikTok. It's, so underscores the importance of the service that Garen provides. So I'm going to start us off with a conversation, a question for AJ and Garen about specific examples of the research that they've done and how that's been sort of used and has made an impact on a policy that's actually been enacted. Obviously, there's a lot of different elements that go into a policy being chosen by a legislator and all of the aspects that go into making that go from a bill idea to a law signed by the governor. But this research information is one piece of that puzzle. So AJ, can you give us an example of any of the work that you've done that has translated into a bill that became a law? How a bill became a law? You're on mute, so.
Sorry. So I can give you an example, but I cannot 100% guarantee that it was specifically because of our work. A bill did become law that addressed one of the barriers that we found in one of our early studies. But since we do not, as an academic institution, sponsor legislation, we know that the office had our report, but we were not necessarily, we didn't have that hand in it. So we hope we were helpful, but I don't want anybody to, say that I was claiming that we did that. Good, but this is what we do: is we put the information out there, we put it in the hands of the people who can act on it, and hope that they do. And in one case, one of the barriers that we found to care in our first study had to do with women who were on some public programs to get their breast cancer care. When that was originally passed by the legislature, the time limit for coverage was 18 months. And anyone who knows somebody who's been through breast cancer care, and if you know multiple people, not everybody's experience is the same. And so to suggest that 18 months was going to fully satisfy the full scope of care that every woman might need felt arbitrary. And so we, found that information, heard that frustration from providers, from patients, from women who worked with that program. And a few years ago, Tony Atkins did pass legislation to remove that 18-month time limit from the from that program. So we were very happy about that, because it was definitely a big theme that we heard during our study. And so we were very glad to see that pass. I was also just in Sacramento last week, sharing, again, just educating lawmakers about what we found for our barriers to breastfeeding study that we did. And one of the policy recommendations that came out of that study has to do with insurance coverage for lactation specialists. We found during our study that whether or not a woman saw a lactation specialist and how many times she saw often depended on what hospital she gave birth at. And often once a woman left the hospital, they no longer had access to that lactation specialist that they had initially seen. And there was only one woman in our study who reported that her insurance covered her access to lactation specialists. And given that we heard all the women who had a lactation specialist credited them with being such a benefit to them, we think it would help a lot of women. And it's unfortunate that it is not something that is covered. And so we shared that information with the legislature. And again, I don't know that anything's going to happen. We don't have commitments, but there was a lot of head nodding in the room, and a lot of especially the staff for the Legislative Women's Caucus, who said that they believed that there would be members who would be interested in this, in trying to address this issue. And so we're hopeful that potentially in the next couple of sessions, if not this year, that's an issue that could be moved forward.
Excellent. And I just wanted to say it's really important that researchers like you, AJ, partner with advocates. And I know you're presenting at the California Breastfeeding Coalition conference coming up, I think next week, and trying to get the information in the hands of those advocates who can take that next step that you as a researcher don't, which is to say, and now that we know this, you should do X. So it's important that this cross-fertilization happen. And Garen, as I said before, sort of provides that sort of neutral netting, like, so we'll use Garen's work to do the advocacy on our end. But I know, Garen, you just do sort of the straight up analysis. Do you have an example?
I do. It's kind of fun to talk about, some examples of moving the dial. Certainly I think, one of the things that helps draw the faculty and the staff to the work we do. We've done over 240 reports. I've been around for over 140 of them. And many of those bills, you hear the reports that we do cited in the process, and they're discussed and voted on very quickly after we release the reports. And sometimes they're vetoed, and we see examples from our report in there, for better or for worse. I'll briefly talk about an example from earlier in my career. I started out in the Department of Veterans Affairs, working in health economics and outcomes research. And this was sort of in the late 90s when the VA was going through a massive change. I mean, it went from a very centralized, big inpatient facilities to suddenly a vast network of outpatient facilities. And it was a huge change. One of the things we were studying was a really innovative program in the Department of Veterans Affairs around hospice programs, both inpatient and outpatient or home-based hospice care. And they were one of the first to do that. And it really struck me. I was involved in a time motion study where I sat outside of patients' rooms and actually monitored how much interaction there actually was with the patient. Very old school. But this really stuck with me, and I became really fascinated with palliative care and end-of-life care. And a few years later, when I was working in state government in Massachusetts, I discovered that we didn't provide coverage for hospice care. And I started those conversations drawing upon from the research that was out there, drawing upon from some of the VA research, looking at improved outcomes, quality of life measures, the benefits to patients and their families, as well as caregivers, and was able to convince our commissioners and my executive director to introduce that coverage to about 250,000 Massachusetts retirees and residents. And that was sort of a directive, very gratifying of sort of moving the needle. And then we actually continued on to create a nonprofit organization working with other state partners and Mass Medical Society and others to actually promote end-of-life care. So that felt like a big win as a 25-year-old. And it really sort of taught some early lessons of bridging silos, federal, no one knew what was happening in the VA. and really sort of having the audacity to propose something different in state government. So that was really through a sort of an agency action. And sometimes we forget, we spend a lot of time thinking about, what the front person of state government, what the governor wants to do, or what the legislature is talking about. But a lot of times there's a lot of autonomy at the agency level, and we shouldn't forget about those opportunities as well. One other brief example I'll bring up was work that we did out of the University of California. A lot of what we do is information sharing. So a lot of times from the health committee staff, I'll get asked, send stuff that you think we should know outside of our sort of formal process. And yet, we're judicious about that because I don't want to appear that I'm advocating for a particular thing. But when it's sort of like building their body of knowledge. And so one thing that we did with UC Davis is actually bring out people from Massachusetts who had created the Massachusetts Health Policy Commission. California really didn't have any statewide process to think about what was happening in healthcare consolidation in the state, what was driving healthcare cost and so forth. And we brought people out and met with the governor's office, the heads in the Health and Human Services Agency, and really help people have informal conversations looking at another state. And sometimes even though people may hear in sort of the background of another state, you bring those people to your home territory and suddenly it makes really a profound difference. And so there's an example of just sort of bringing people together and planting those seeds can generate a lot of results. And finally, I think, so much of what we do is about capacity building, providing the data, the analysis, the infrastructure to do public health and health services research in California and how important it is. And it's kind of gratifying to see in recent years, people catching up to what we've known for a long time, which is you can't separate out nutrition or educational status or transportation gaps or disparities in air quality from health status. And a lot of what we do are the underpinnings to actually provide that multidisciplinary analysis and information to drive policy.
Excellent. Yeah, I think the idea of states sharing ideas across states is one that we participate in a lot on the toxics front. So I think the states as the laboratory is a real thing, and sharing across states and with the feds is important. So we have a question, which is awesome. Gagik, is that how you say your name? Could you introduce yourself? Just when people speak, if you could just tell us who you are, where you're from, so we get a little bit of a context, and then go ahead and make your comment or ask your question. Hi,
everybody. I am Gagik Melikian from Chemistry Department of California State University, Northridge. I'm organic and organometallic chemist, organometallic in the sense of heavy metals like lead and cadmium. And for the last 15 years, I have also been working as an expert and consultant on Prop 65 litigations. And one of the things that has always been on my mind, actually, to introduce to the policymakers or to suggest some changes. More specifically, Prop 65, most probably some of you know this, having certain exemptions. For example, companies which has or claim to have less than 10 employees, they are exempt from Prop 65 requirements. And what's happening if someone is bringing in some food products which has this heavy metals I was referring to, or other listed chemicals, as a matter of fact, they can claim that they have 9 people or 10 people or less, and to manufacture by creating the small company. And we have seen this for now 1.5 decades. It will be nice to remove that exemption, so that no matter how many people are in the company, they are not supposed to bring in that adulterated products and poison the California public, and as a matter of fact, American public. So the problem is that I am a scientist in this interdisciplinary field, but I don't have any experience how to start the process so that that exemption can be removed. So what probably we need to have some follow-up conversations with Garen. I can see he is very experienced in that. So I would like to send my email to everybody if you have any kind of suggestions, so with whom we should just cooperate with, join forces, so that it won't take another 5 or 10 years until we can implement this change. And I will appreciate any kind of comments that you can make right now.
Excellent, thank you. Yeah, I will say that the advocacy group that I work with the most that works on Prop 65 is the Center for Environmental Health. They have been defending Prop 65 from attacks from industry for a very long time. It's a hard law to change, which is both good and bad because it was implemented by a proposition. So it takes 2/3 of the legislature to make a change to the law, which has protected it from a lot of attacks from industry, but also makes the kind of improvement that you're talking about a little bit of a challenge. That said, I would definitely direct you to the Center for Environmental Health, and I couldn't agree with you more. It shouldn't matter how many people you have in your company if what you're doing is poisoning Californians. So thank you for the work that you do and for your engagement on that really important law and doing what you can to get it to be as effective as possible. But yes, I'm glad you shared your email. We can see if other folks have ideas. Are there some other folks who want to either ask a question or give an example, or, I know people had asked about how to go about developing research or developing, what was the wording of that? Developing research to inform policy. Is there so that's a great example from Gaik about how to, like, what's the policy change? So how do we get research that supports that? Are there some other ideas out there from folks?
Well, if you were going to design a research study working on that, what you want is quantitative data to demonstrate how many companies fall under this exemption and what kinds of companies they are and what they're doing. And then and I don't know, so I apologize, but if there is a mechanism already existing, whereas there is reports on things that are happening because of the company's exemption, if there are ways to tie their existence to issues that have been discovered by the use of these chemicals, or that's in the lack of that, that's what a research study would have to then uncover. Where are there stories? Are there links? What can you demonstrate among these companies that are under this exemption about what they are doing that should be prohibited if they literally just had a few more employees and fell under the law?
I can briefly comment on it. There are many of them actually over this 15 years that we have been involved in Prop 65 litigations. Whenever we start the litigation and we file what is called 60-day notice, so they present data to the Attorney General office. That number of employees is less than 10, and right there, the process stopped. I'm sure that the AG office definitely has the number of companies, but they were trying to, with groups like ours, try to sue them, and we couldn't even start the process because of this exemption. So I'm talking most probably very large number of cases and very large number of chemicals which are in those adulterated the products.
You can start by quantifying that. That would illuminate the problem nicely.
Indeed. So Narissa, so we only have about 5 to 7 more minutes. So I'm gonna hand it over to Narissa to ask her question or state her suggestion. So Narissa.
This is fantastic. Thank you so much for putting this panel together. I live in the world of research and working at an agency, so I am not on the policy end. And so hearing your perspectives is really useful. I had the Biomonitoring California program, which many of you are very aware of. We do measure chemicals like NHANES in the blood and urine of Californians, and data has been used for things like demonstrating that every California essentially has a whole host of PFASs in their body or metals. And that data is very useful for demonstrating that things that exist in the environment are generally in our systems and are biologically active. We have metabolites of these things in our bodies. But we have a number of challenges, and I guess they're equally distributed among you. One is that getting a good population sample is really difficult. Biomonitoring requires that we not only ask people questions, but that we get an actual biological sample, and study participation is difficult enough to get. I was just at a conference where Wisconsin talked about their show, which is equivalent to CHIS there, and they also have a biorepository associated with us. And CHIS is one of the groups we've been eyeing, thinking, could we use this as a sampling frame? That would be so handy. So that's one thing. Is there any potential for that? The other is, how can we be more timely with our work? We're currently doing all this work that's very related to source attribution for PFASs, which is great. But in order to put together the study, get the data, do all the lab analyses, and then start digging into the epidemiology, we're doing this while all this legislation is being proposed. Our timing's kind of off. So how can we fix, get to a place where we're more nimble and able to be ahead of when legislation is getting out there? And then finally, how do we get our work in front of the people who should be seeing it? Because again, we're not the people who can talk to legislators. We're probably guilty of putting out the 50-page reports that nobody wants to read. We are trying to get to more infographic type thing, but how do we get that into the right place?
Great. Yeah, so that issue of like the timing around research versus the timing around policy is one that we were thinking about when we put this panel together, and the fact that that research takes years at a time, whereas the legislature works in months and 2-year buckets. So it is a challenge. Garen or AJ, do you have a comment on?
I mean,
on that?
I feel like we need to like pour some glasses of wine and spend the evening talking on these great.
Okay.
Let's go. But I think one of the hard parts is that we all often try to time our work. And I would say what's most important is to start the conversation, get information out there, engage with stakeholders, and try to get out, information that helps either answer the why or what's happening in a way that engages. And it start at the local levels, whether or not it's your county supervisor or city councilors. A lot of times that's where conversations start to generate, and connectors start to engage people in the community who might want to get involved in an issue or know about other people who are sort of in their silos, hoping to get some good information about a topic or an issue. A lot of times, localities and county supervisors are pipelines of information and insights and ideas to legislators and their offices and their district staff and so forth. So I guess, I love the one-pagers. I love the conversations, working with as many stakeholders to engage people as possible. But I think, the biggest thing is there's no wrong time. It's to start doing and build those muscles, because a lot of times it's the random neighbor or the cousin of a legislator that actually is where the antidote is taken off. But it's all of the other conversations and process that is sort of always ongoing. That is sort of the tidal wave that moves things forward.
And in terms of CHIS, we have lots of organizations that do follow-on studies based on our sample. And so we are very happy to have those conversations with you. It is a pretty popular process. So I recommend starting that conversation earlier than later if it's something you really want to explore. But we definitely are open to that, because we want our data to be as useful as possible. And if there's a way that it can help you build a better study design, we look forward to engaging in those conversations.
Thank you all so much.
We're about to run out of time, so I just want to point out that Sharima just put into the chat a topic suggestion link. So the policy initiative, which does these sort of short-term, smaller size research grants, has a sort of place you can go and say, we think you should spend money looking at this research gap. And we're always looking for really cutting edge, relevant, important subjects for us to think about as putting a call for proposals out. So I would encourage you to take a look at that link, look at the policy initiative overall, and make suggestions about the subject matters that are important to you. I know we're about to run out of time, but I just want to raise one other general issue, which I think is relevant for some of the stuff that Narissa talked about, which is the importance of engaging community in all of this research. Like, the people who are most directly impacted really need to be a part of the conversation. And I know that's something that CBCRP has been sort of on the cutting edge of. But I just, I don't know that we have a lot of time to get into it. I feel like we just scratched the surface and now we're going to have to go. So hopefully we can continue this conversation in another forum. Before the breakout session sort of ends on its own, I just want to say there's going to be a few-minute break. I think we're cutting into it now, so it's probably going to be a 5-minute break. And then I would encourage you to come back to the full conference, because Katie is going to Katie McKenzie is going to talk about funding opportunities going forward, which is going to be important for all of us to know sort of how can we continue to engage even at a deeper level on a lot of these issues. So I want to thank everyone for being here. I want to call out Peggy, who I think, there's Peggy. She's done a couple of these research projects as well for the policy initiative on some of the chemical policy side. I want to thank Narissa for the work you do. I use that data all the time, both to support your program and to pass legislation. And, that kind of marriage between the research and figuring out how to present the research in a way that regular humans can understand it, like me, is a really important piece of this whole process. So I'm going to give folks any last comments before we get sucked back into the main world. I want to thank AJ and Garen so much for participating. Peggy, I saw you like.
I want to make one quick comment, which is I wanted to reiterate and underscore your comment about partnerships, because I also come, Narissa, from an institutional background where I appreciate all your issues. And I'm an epidemiologist, so I'm like, scientist, what do I know? And so I think the partnerships with organizations like BCPP have been very critical in terms of our trying to do work that's relevant on these issues. So I just wanted to reemphasize that partnership idea.
And
so
I
much.
want to say a big thank you to all of our panelists, but especially to Nancy for chairing this session. And thank you all of you for attending. As I say, the next session in the main room, the same main room, will start at 1:45. So you have 4-minute break.
And I just put my my email in the chat. If anybody wants to reach out to me, as I said, I know a number of you, but I want to just thank everybody for. I'm sorry to cut you off, Sharima. I just want to give people a heads up on the email.
That's great. Okay, well, thank you so much, and thank you to all of our presenters. And I look forward to seeing you back in the main room.
Thanks everyone.
Everybody.